Good morning, friends. A warm welcome to you all. Today we'll continue with a very interesting case, and through this case, we'll learn a very useful remedy. And this case I had solved through the mental symptoms or understanding the mind of a patient, psyche of a patient. It's a very interesting case. The case goes like this: one patient, he was a 21-year boy, he was a medical student. He came to me and he was in lot of trouble and he was very depressed. He said, sir, मैं बहुत डिप्रेस हूँ. एक दो महीने से आई एम फीलिंग वेरी बैड. आई एम फीलिंग आई एम हैविंग लॉट ऑफ एंजाइटी. मुझे समझ में नहीं आ रहा है, बहुत एंजाइटी हो रहा है, बेचैन हो रहा है. आई हैड वेरी पैनिक अटैक्स. आई एम नॉट एबल टू स्लीप प्रॉपरली. आई हैव palpitations. मुझे कोई चीज़ में इंटरेस्ट नहीं आ रहा है, मेरा मूड बहुत लो है. And being a medical student, he knew that something was not right, something was not good with him. So he taken advice of his uncle who was a doctor. He said, you take some anti-anxiety pills and you consult a psychiatrist. But he didn't went to the psychiatrist, or he didn't took that medicine. He came to me, as he was my student. He came to me and he said, sir, मैं बहुत परेशान हूँ, right? आई एम नॉट एबल टू स्लीप प्रॉपरली. बहुत पैल्पिटेशन होता है, सैड लगता है, कोई चीज़ में इंटरेस्ट नहीं है. सर माई मूड इज़ वेरी लो, राइट. एंड इन इंटरव्यू मेनी टाइम्स यूज अ वर्ड अचानक. सर अचानक कैसे हो रहा है, अचानक हो गया. सर अचानक एंजाइटी हो रही है, अचानक पैनिक हो गया है. तो आई थॉट दिस वर्ड अचानक, समथिंग स्ट्राइकिंग वॉज देयर इन. आगे देखते हैं हम ये कैसे इंपॉर्टेंस आएगा इसका. Okay, in the history he said, I asked what is the main trouble. So he gave me detailed history. He said, sir, he said, I have had the history of watching porn and masturbation from last 5 to 6 years. And he said I had a lot of sexual desires, right? He said I had a strong craving that I should also have girlfriend. But he didn't had any girlfriend, or he didn't had any sexual relation. But he was having strong urging for watching porn and masturbation from last 5 to 6 years. Okay, interesting, friends. Going ahead, he said, I asked him, uh, how did you got this depression, anxiety? कैसे हो गया है आपको? He said, sir, सब अच्छा चल रहा था, but I stopped masturbation and watching porn on mobile. And on one sudden day or few days back, I stopped using Android phone also. मैं Android phone ही use नहीं कर रहा हूँ. I'm using this small regular वाला phone, right? I'm using a regular phone. I'm not using an Android phone anymore, because when the phone is there, I used to watch porn on that and I used to masturbate. So उसने वो बंद कर दिया use करना. Okay, he also used, sir मुझे बहुत बोर हो रहा है. Sir, I feel very bored. I don't want to मीट पीपल. आई डोंट वांट टू सोशलाइज. मुझे किसी से बात करना अच्छा नहीं लगता है, बहुत अकेला अकेला लगता है. तो मैं बोला क्या करते हो फिर, कभी किसी से बात तो करते हो? नहीं सर, कई एक फ्रेंड, ओकेजनली आई कॉल अ फ्रेंड, उससे बात करता हूँ, थोड़े टाइम बेटर लगता है, अगेन आई फील वेरी बोर, राइट. ही सेड आई वांट टू रिमेन अलोन. मुझे अकेला रहना पसंद है, ज़्यादा बात नहीं करता हूँ, शादी में नहीं जाता हूँ, राइट. दिस वॉज द नेचर ऑफ दिस पर्सन, फ्रेंड्स. And he said, sir, I tried everything. I did meditation, I did yoga, right? But nothing was helping me. That anxiety, depression, sadness, sleeplessness, palpitation, all was there. It was not going. Okay, he also said, sir, I had addiction of uh, Nicotex chewing gum. He used to chew that Nicotex chewing gum for 6 months. And he also said occasionally used to drink also. Okay, now I was trying to understand what is the case. What is the problem with this guy? Because on other aspect, he didn't had any peculiar symptoms, or I could not find any other thing. I didn't went into other details, but I was trying to understand what is the psyche of this person, what he is going through. So what I understood that he had developed some wrong habits, right? And that wrong habits like addiction, porn, masturbation, hypersexuality, and that was creating a kind of guilt in his mind. उसके mind में guilt आ रहा था कि यार ये wrong है, ये नहीं करना चाहिए. And he was trying to control that. वो habits and addiction, he was trying to control it, right? And that was causing a depressing effect on him, right? Means what? He was knowing that he is doing something wrong, but by trying to control that, there was a fight going on, and he was becoming more depressed, right? And he was realizing that I am depressed because I have stopped this act, and this was creating a chaos. This was creating a cycle, right? Means guilt was there, and he was trying to control the situation, but it was he was unable to control. See, that control became his ailment. वो जो कंट्रोल करने की कोशिश कर रहा था, that became an ailment, right? Also he had jealousy. He said, sir, बाकी दूसरे दोस्तों के गर्लफ्रेंड्स है, मेरी गर्लफ्रेंड नहीं बन रही है. Whenever I watch a girl going with a boy, I feel very jealous. Yeah, I'm not having a girlfriend, right? So this was a vicious cycle going on. And there was a loneliness, kind of loneliness. He was feeling very lone. मेरे साथ कोई नहीं है. I don't have a partner, right? And he was saying, sir, bore हो गया life से. I have no interest left. Being a medical student, I have no interest left, right? He was in such a bad situation, right? So I analyzed the case with the help of repertory, and I have taken few rubrics. And these rubrics, when I compiled it together, I came to a remedy. And rubrics I took was anxiety, continence from prolonged. He was saying ना anxiety sir बहुत परेशान हूँ, बहुत चिंता हो रही है, बहुत सैडनेस लग रही है, बहुत पैनिक जैसा लग रहा है, कुछ समझ में नहीं आ रहा है क्या करना है, right? Indifference, apathy, ennui with sadness from suppressed sexual desire, and very important rubric, ailments from celibacy. After compiling all these rubrics, we came to a remedy known as Conium maculatum. Another rubrics, other extra rubrics I could add in the repertoire was company aversion to, ennui, boredom, disgust. He was feeling disgust about himself. So what I am doing, being a medical professional, I know I shouldn't do this. But that was going into a compulsive disorder. It was becoming a compulsive act for him. Sadness from sexual abstinence. After compiling all this, I came to a remedy called as Conium. And medicine prescribed to this boy was Conium 2. And he was better. He was very much better. He was more than 70 to 80% better. And that could be guessed from he started getting more socialized. He again started using the Android phone. He again started WhatsApp. He texted me on the WhatsApp that sir, I'm better now. I'm feeling very relaxed. All anxiety, all panic, palpitation, they are very much reduced. And I have stopped this habit of watching porn. And I also stopped masturbation. I'm feeling better. He started. He went to a. He started practicing. He went to a doctor. Uh, he became assistant there. He started practicing. Okay, he started to get normalized with the life, and with a few doses of conium 200, all his depression, sadness, anxiety, palpitation, they went off. Isn't it interesting, friends? Now, let's try to understand few rubrics. Important rubric I took was indifference, apathy, ennui with. See, indifference, we all know indifference is nothing but lack of interest, no interest in anything. And he was also saying, sir, बहुत बोर हो रहा है, कुछ मन नहीं लग रहा है कोई चीज में. Boredom, ennui is nothing but boredom. See, indifference means lack of concern, lack of interest, no interest left. कुछ करने का मन नहीं है, राइट. जॉब करने का मन नहीं है, काम करने का मन नहीं है, प्रैक्टिस में जाने का मन नहीं है, एंथुजियाज्म नहीं है, राइट. दिस इज इंडिफरेंस. Some synonyms: apathy, views, disregard or negligence, right? These are synonyms of indifference. Ennui means lack of spirit, boredom, interest nahi rehna, weariness. Okay, this is ennui. Ennui is boredom, interest nahi rehna. See, we most of the time we attach this with persons who have a lot of time in hand and nothing to do. तो बोलते हैं ना बोर हो रहा है. टाइम बहुत है उनके पास पर करने को कुछ नहीं है. दैट इज एन्यू, बोर्डम, राइट. तो ये भी बंदा क्या कर रहा था? वॉचिंग पॉर्न, मस्टरबेटिंग, हैड नो इंटरेस्ट लेफ्ट. उसका लाइफ वही सर्कल में था. एंड दिस वाज गिविंग हिम अ बोर्डम, नो इंटरेस्ट इन एनी अदर थिंग, नो एक्टिविटी. ओके, सी, in this case the guy lost interest, enthusiasm in life, right? He lost interest. And previously he was enjoying that, he was enjoying porn, he was enjoying masturbation, he was getting the feeling of pleasure out of that, right? But now he has lot interest. बोला सर मैं बंद कर रहा हूँ, right? अब मुझे कुछ इंटरेस्ट नहीं आ रहा है, बोर हो रहा है, लैक ऑफ स्लीप है, doesn't like to go out. In this way I use this rubric, indifference anyway with. यानी पहले जो चीजें करने में बहुत मजा आ रहा था, he was enjoying that. Now he was feeling bored of that, मजा नहीं आ रहा है, because he had stopped that, because he was trying to control the situation, because वो guilt आ गया था ना. That guilt, out of that guilt he was trying to control the situation. Okay, now let's study this conium through mind rubrics. Conium is a very very interesting remedy, friends. I want you all to use when the situation comes or when a patient comes like this. We all know that it is nothing but poison hemlock. We know the history or story of Socrates, how he was poisoned with this poison hemlock. Now we know that it is very very toxic plant, poisonous plant. It contains alkaloids. Conine is one of the alkaloid which is having strong effect on the central nervous system. It causes paralysis, ascending paralysis, paralysis of the respiratory muscles, and a patient die because of that respiratory failure. Now let's try to evolve conium through the mind rubric, right? See, conium patients is not really a very sweet kind of person. They say we feel pulsatilla are very sweet, phosphorus are very sweet kind of a person, but conium are not really sweet kind of person, but they are very hard. They are a materialistic person, they are practical person, काम वाले, काम धंधे वाले, materialistic. Okay, he is morose, dictatorial, with an intolerance for any kind of contradiction. Okay, they can't bear any kind of contradiction, right? They are kind of dictator, they have a dictatorial attitude. See, we have conium in the rubric contradiction. Conium can't bear a contradiction, they are dictatorial in nature. See, they have rubrics like unfeeling, they don't have feeling, they don't have that much emotions, they are very practical. They are hard hearted people, hard hearted, patthar dil wale, haughty, narrow minded. They are very narrow minded, unka thinking very narrow. Moral feeling want of. They don't have a moral feeling. Okay, in grown-ups individuals, we can see this rubric ailments. Oh, sorry, ambition increased. Ambition increased fame for. In young people, rubrics. These rubrics like ambition increased fame for. Like in our Naxwamika or Staphysagria, ambition increased. Lycopodium. This symptom is in Conium also. Okay, they are intelligent but problem lazy at work. Conium is an intelligent remedy but they are lazy. Lazy लोग होशियार है पर आलसी है. Think of Conium. See, bed desire to remain in. They feel better comfortable in bed. No desire to work. Lazy होते हैं ना, तो बेड में पसंद है उनको रहना. See, mind dullness, sluggishness, difficulty of thinking and comprehending. Unable long ज्यादा देर तक वो सोच नहीं सकते, राइट. ज्यादा दिमाग में तान नहीं दे सकते, राइट. Okay, he is attached to the material world like property, his friends, his habits. Smoking उसको attach है. Materialistic cigarettes, right. Expensive cigarettes, expensive drinks, expensive alcohol, properties, his family is attached to them. Once he loses any material possession, there is a definite morbid and pathological reaction. This is the problem of Conium. He is very much attached to the material world, and when he loses that, pathological reaction starts. A Conium patient enjoys life in the best possible way through extravagant shopping and spending on clothes and other material possessions. तो कोनियम क्या है ना, कोनियम खुद के ऊपर बहुत पैसा उड़ाएगा, एक्सपेंसिव शॉपिंग करेगा, महंगे महंगे कपड़े खरीदेगा, राइट. बिकॉज ही लाइक्स these material things, he's attached to them. He has a tendency to think that material objects are more important than people. यानी लोगों से ज्यादा material चीजों को importance देता है कोनियम. His focus is on objects, ownership and wealth. वो लोगों को हासिल करना चाहता है, ओनरशिप चाहता है उनके ऊपर, वेल्थ चाहता है, राइट. वी हैव रूब्रिक एक्स्ट्रावेगेंस. दिस इज वेरी हॉटी क्लोथ्स. कपड़े भी ऐसे पहनेगा ना, वेरी रिच, वेरी एक्सपेंसिव, वेरी डिफरेंट, आउट ऑफ द ऑर्डिनरी. ऑर्डिनरी नहीं, एक्स्ट्रा ऑर्डिनरी कपड़े दिखेंगे उसके. यानी 100 लोगों में से you'll identify, यार ये क्या कपड़े पहन के आए, राइट. Haughty clothes, best clothes likes to wear his. He lives the life to the fullest. कोई नया कपड़ा लाएगा, नए कपड़े लाएगा, next day he'll wear because he likes to wear the best clothes. Materialistic people, they are very materialistic. They are squandering money on themselves only for their satisfaction. Avarice, they are very avarice. Conium people have a strong sexual urge. This is a core of Conium. Sex is something they just need from time to time to experience the satisfaction of release of hormones. Right? They need sex time to time. They feel that they must enjoy all good things in life. They must enjoy smoking, masturbation, alcohol, right? Nicotine chewing gum. They must enjoy things. They do not need they do not tend to have bad things or feelings of guilt or doubt about what they do. In initial phase, they don't have any guilt. This guy also for 5 years he was continuing that habit, right? He was enjoying nicotine chewing gum, alcohol, masturbation, watching porn. There was no guilt at that phase, initial phase. They know exactly what they want. Sex orgasm to keep them functioning properly and well. See what happens when they enjoy, when they have the sex. Okay, when they reach that orgasm, they feel that that is very necessary for their normal functioning, for release of hormones. Conium is a remedy that leaves sexuality in a very special way. You'll see a lot of rubrics of sexuality in Conium. Lividness, absence, livid. They are very amorous, lascivious. Fancies, they are always in the thoughts. Lascivious thoughts are there in their mind. Thoughts sexual. Thoughts tormenting. Even tormenting. This boy also, he was tormented with that sexual thoughts. Girlfriend nahi hai, sexual relation nahi hai, watching porn, masturbating. All those thoughts were in his mind. They were tormenting. Monomania. एक ही चीज में लगा हुआ है, एक ही चीज में लगा हुआ है, एक ही चीज में लगा हुआ है. This is monomania. So the biggest material loss for Conium is the deprivation of regular sexual activity. Means whenever they don't get this regular sexual activity, their problem starts. Okay, what do you mean by regular sexual activity? Sex is something that people enjoy and find meaningful way if they create meaning in different ways. Sex is pretty much anything that feels sexual. Sexual feelings are exciting, means they want excitement, they want release of hormones, right? So whenever they are deprived, the problem in conium patient starts. Whenever they don't get that excitement, release of hormones, the problem in conium starts. The moment a conium patient loses regular sexual activity with his or her partner, the problem starts. The conium patient's bodies function well as long as there is regular release of hormones. This is what they need to feel in balance, or else the balance is lost. Means what? Whenever they have a regular sexual activity, there is release of hormone, there is balance. But once the sexual activity is stopped, the balance gets disturbed. There is an imbalance, and the problem starts in conium patient's life. Conium is, we say now, conium is a remedy for people who have lost or separated from their partners, widows, right? Widows or separated, divorced person, or those who have broken up the relation or don't have a new love affair. This is a very very interesting rubric. Ailments from celibacy. This is a rubric in the case. Ailments from celibacy. Celibacy is, he was trying to control. Self control is celibacy. Abstinence from sexual activity from himself, that is celibacy, right? He was trying to suppress his sexual urge, he was trying to control the urge to masturbate, to watch porn, that is celibacy. See, anxiety continence from prolonged anxiety. In the case ना, he was saying ना सर बहुत anxiety है, panic है, कुछ मन नहीं लग रहा है, उदास लग रहा है. This is anxiety continence from prolonged. Continence is trying to control the things, trying to avoid it. Mind sadness again from suppressed sexual excitement. See how beautiful this rubric is matching. Sadness, this patient was sad, depressed, नींद नहीं आ रही है, sleepless, and why? He was suppressing his sexual excitement. Isn't it beautiful? Sadness, depression, melancholic from suppressed sexual excitement. See, I'll tell you one. I had one case where the female, she had a complaint that her menses were irregular, menses were very delayed, and she said, sir, I have increased libido, but my husband, he's away, he's on a duty, right? And he doesn't show much interest, but I have a lot of interest. So I could sense that There was a problem that her sexual excitement, she was suppressing it, or it was not getting fulfilled. And that may be the reason that she was also little depressed and her menses were also late. I prescribed her conium, and after conium her cycle started to come regularly. In such way also you can think, isn't it interesting? Now see, his problem starts with his ailments from sexual excitement, ailments from sexual excess, ailments from love disappointment, ailments from fortune reversal of, see, fortune reversal of, ailments from celibacy. Fortune reversal, we have one example, we'll see that. Conium has the strongest delusion of being pursued by enemies. See, in later stages, Conium starts to develop delusion कि कोई मेरा पीछा कर रहा है, enemy is following me. So he is on the always on the guard, right? कि कोई आ रहा है क्या, कोई देख रहा है क्या, और इसको he starts developing fear of people, and that takes lot of toll of his energy and it disturbs him. उसको क्या लगता है, everyone around him appears to be an enemy. See, we have a beautiful rubric. Delusion persecuted, he is persecuted. Pursued, it's followed by enemies, right? See, delusion assembled things, swarms, crowds. What he feels that a large flock of insects are moving towards him, or they are assembled at one place. Delusion animals are dancing in the bed. What he feels, animals are dancing in his bed. All kind of delusions start to creep up. The delusion, someone has come at the door at the night. रात में कोई मेरे डोर पे आ गया है. See, people are entering at my house at night. Night again, night has come. Delusion, people entering his room, he hears कोई मेरे रूम में एंटर कर रहा है. ये fear develop हो गया है. Delusion, front of him people are in front of him. See how he is landing into this stage of delusions. And see, जो एंटी सोशल था, जो इसको सारे लोग दिख रहे हैं, परस्यूड है, एनिमीज है, राइट? थीव्स, डिल्यूजन थीव्स आर इन द हाउस. जैसे हम नाइट्रम में देखते थे ना, नाइट्रम हैज फियर ऑफ थीव्स. इसको डिल्यूजन, चोर घर में घुस गए हैं. सच a level of depression, sadness creeps into his mind, and he develops such kind of phobias special to people, and that is reflecting in his delusions. See, the main cause of disturbance in a conium patient is due to third person whom he has provided him or her with most important necessity. यानी उसके लाइफ में जो एक important person है, when that person goes away, when he loses that person, and that person he was kind of attached very much, right? Like a material possession, and that person was providing him everything, sex, and death of that person or loss of such sexual partner can cause reversal of fortune for a conium. Yes, we had seen ailments from reversal of fortune. So in conium, always remember a partner chala gaya hai, and that person partner he was very much attached because that partner was providing a lot of materialistic attachment to that and also giving him satisfaction through the sex. And the death or loss of sexual partner can cause a reversal of fortune for a patient, as everything that he has enjoyed until now has been snatched away. जो वो enjoy कर रहा था, वो उसके से उससे किसी ने छीन लिया है, snatch कर लिया है. When this happens, a conium patient wants to stay quiet. He cannot tolerate any light or noise. जब ऐसा कोई बंदा उसकी लाइफ से चला गया है, he doesn't want any light. Then symptoms come, light aversion to, कंपनी डिजायर फॉर अलोन एग्रेवेशन भी है, राइट। कंपनी डिजायर करता है, येट ही हैज फियर ऑफ पीपल, फियर ऑफ पीपल भी है। अकेला रहना भी, अकेले रहने से कंप्लेंट्स भी एग्रेवेट होते हैं, बट ही हैज अ फियर ऑफ पीपल। सी कंपनी एवर्जन टू अलोन एम्युलरेशन व्हेन, कोई पसंद नहीं है, अकेला रहना पसंद है, आई फील बेटर। कंपनी एवर्जन टू डिजायर फॉर सॉलिट्यूड, राइट। कोई नहीं चाहिए, ही वांट सॉलिट्यूड, ही वांट साइलेंस, he want aloneness. You will get lot of rubrics of this company aversion to strangers पसंद नहीं है। माइंड सोसाइटी मैनकाइंड एवर्जन टू, सोसाइटी चाहिए, अकेला रहेगा कोनी एम्बिशन बाद में, किसी से मिलना जुलना नहीं है। There on the mind of Coney ambition slowly starts to wear out. देखो, when a person is going through this cycle, starting from his materialistic, haughty, right, dictatorial, enjoying life, enjoying sex, and one fine day that person leaves him, departs from him, then he suddenly develops all kind of delusions. He went into a state, doesn't want to talk with anyone, wants solitude, and a state comes when he wears off, he'll start to become very dull, he'll appear very stupid, fool, or like an idiotic person. This is later stage. Imbecility, he'll strike to the wall, he'll in a mania, pagalpan, we'll call it pagalpan wala stage. Hysterical stage, it goes into a hysterical stage where he has lost all the controls, uncontrolled behavior, especially from suppressed sexual act. This boy, he also could have gone to that stage, hysteria, out of control behavior. Insanity, insanity periodical. We have a lot of rubrics of hysteria and insanity in Conium. We'll just wind up by seeing few of the Matra Medica references of Conium. See what Boric is saying. Excitement causes mental depression. Boric explains in very few words. Depressed, timid, aversion to society, and afraid of being alone. Afraid of being alone, yet he has aversion of the society. No inclination of business or study. This is very interesting symptom. No inclination of business. कुछ business नहीं करना है, study नहीं करना है. Doesn't want to take interest in anything. कोई चीज में interest नहीं लेना है. This is memory weak, unable to mental effort. Intelligent but lazy. कोई ज्यादा टाइम दिमाग को दान नहीं देना है, मेंटल वर्क नहीं करना है. Okay, males, we prescribe this on physical symptoms also. Males increased desired, power decreased. Desire बहुत है but power is decreased, and there is effects of suppressed sexual appetite. Suppressed sexual appetite. Okay, if we try to correlate this conium, conium belongs to the umbelliferae family. Umbelliferae family. According to Dr. Sankaran, umbelliferae family, you get a symptom that shocks from effects of sudden and unexpected attacks. Suddenness, umbelliferae family में you'll get lot of suddenness. ये बोलता था ना अचानक, सर अचानक कुछ हो गया है, अचानक हो गया है, अचानक से बंद कर दिया है, राइट. अनएक्सपेक्टेडली स्टॉप कर दिया है एक्ट, राइट. The umbelliferae family, you will see that sudden effects of shocks. Okay, shocks from sudden effects and unexpected attacks. Okay, in Pathak's Matra Medica, what he is saying, this conium is a remedy useful for people of old ages and for those person who become prematurely old, or for old maids, or for bachelors, or for youth who suffer from ill effects of masturbation. See, this is given in bold in Patak. Youth who suffer from ill effects of masturbation. Try this remedy, friends. Conium. Patient who are aggravated when idle, when they are not doing anything, they'll say, sir मैं कब कुछ काम नहीं करते रहता हूँ ना तो मुझे बेचैन हो जाता हूँ, परेशान हो जाता हूँ. Means they want some activity. See, paroxysms of hysteria and hypochondriasis from sexual abstinence or from sexual excess. Both abstinence and also sexual excess. You'll see that there is a lot of hysteria, there is a lot of sadness in conium. Okay, mind depressed, timid, aversion to society. Again, all same things. No inclination to work, difficulty in understanding, superstitious, unable to sustain mental effort. All symptoms are again same. They are sad, dissatisfied with himself, herself, guilt wala complaint comes. Okay, again they make useless purchases, shopping, expensive shopping, always want to wear their best clothes. This is very important, striking in conium. Always want to wear their best clothes, and there is a lot of feeling of guilt. उसमें गिल्ट होता है कि यार मैंने गलत किया है, यार मैंने बहुत ज्यादा किया है, राइट. Okay, fears, we have seen a lot of phobias, fear of men, fear of people, fear that enemy is chasing me. These all things comes in conium. Isn't it interesting? How do you find it? Okay, this was a different shade of conium, and thank to my patient that I from because of him I was able to learn this remedy in detail, and after that I've prescribed conium a lot. Core was that, and from that core I prescribed conium a lot. So this is my address, and I hope you liked today's video and this was some insight to you. You can write to me, you can contact me, and if you like this video, do subscribe, do share with your friends, and we'll continue with this series of new learning through cases in upcoming videos. Thank you all. Bye bye. See you in next video.